Welcome back, YouTube family. I know y'all need some deep healing. I'm Kamara and I'm here to give it to you. We're going to be talking today sciatica. So either your doctor told you that you have sciatica or you have self-diagnosed yourself with sciatica. Either way, we're going to kind of talk about what sciatica is, because a lot of people have a misconception about sciatica and they think, you know, sciatica is a diagnosis of some sort. So that's a big misconception. Sciatica is actually a symptom. So you have to identify the cause of sciatica. So that's what we're going to be talking about. So sciatica is basically just a pain that radiates along the path of the sciatic nerve. You have to understand that nerves are connected to other nerves and they branch off, and you have basically pain referral patterns, and you know there are things that are actually causing your sciatica. So those two muscles that are clear indicators of sciatica are going to be Glute Minimus and Piriformis. Now these two muscles are right next to each other. Sometimes they kind of overlap with their muscle fibers, and then they have adjacent attachments. And then these two muscles also have kind of similar pain patterns. So I'm going to tell you guys how you can distinguish between the two, because you want to get down to what's causing the sciatica. And then you may have both. I am a victor. I am a victor of these two muscles. So I know what to do, you know, when they're giving me pain that mimics sciatica. So the first one we're going to talk about is the glute. Now the glute is the deepest, lightest, and smallest of the three glute muscles, but it causes the most hell. And that's usually how it goes. Piriformis too. Piriformis is super tiny, but it causes the most hell. So the function of your glute minimus is, if you were to stand on both of your legs and then lift one of your feet, your glute minimus is more of a stabilization muscle. So it stops your pelvis from tilting down if you were to stand on one leg. Glute minimus also abducts the thigh and medially rotates the thigh. So the pain from this little muscle is deep, it's constant, it's intolerable. It literally screams at you. Like, I've had it and just been like, somebody please stick the elbow in my glute. So you can feel this pain pretty much all over your glute. And then the pain referral pattern is, it's going to be kind of all over the glute, but you'll feel it more on the outside, so the lateral side. And then this pain can either go down the side of your leg, and it can go past the knee and into the ankle. If it's gotten to the ankle, it's real bad. Like, that muscle is really, really tight and it needs some release. And then it can also, it can switch back and forth, but it can also go from the glute, all over the glute, mainly on the lateral side still, and then just go down the back of the thigh. So, and then it can go, you know, same, kind of down into the calf. Some signs and symptoms are, you're gonna feel when you're like lying down on whatever side is affected, you're gonna feel like an excruciating pain. It may feel like a deep, dull, achy pain. For me, it's like a burning, screaming pain. And then you may feel like you aren't really getting any relief, whether you are sitting down, stretching, lying down. It may feel like nothing is helping. You may feel a ton of immobility too, like you just can't move as good. And then for like people, ladies, you know, the way we cross our legs, you may feel like you can't cross your legs. So then what are you doing to activate and perpetuate these trigger points? So if you're walking real fast for a long distance, or if you're a long distance runner, especially if you're running outside on rough terrain, it's just not ideal. Like, it's I was in the military, so for us in the military, like they have you running, you know, a 5K. You know, it's just, that's why so many military people have knee problems and like these back problems, low back problems, is because you're doing this to yourself. So if you are going to run outside, you just need to put some type of padding in your shoes or do something to protect yourself, because the ground force is coming up like bam, hitting you right in the hip area or in the knee. And then you also have gravity coming down, so you have like dual force, and it's just not good. So this is also a muscle that you do not want to be getting shot in. Do not let anyone, you know, shoot, you know, stick a needle in you in this muscle. So this is not a muscle for intramuscular injection. It's just too deep. So you really want, if somebody's giving you a shot, they want to be going for glute minimus, or I'm sorry, glute maximus. It is surface level, you know, it's a big, huge muscle. You really can't miss it. Also, if you are sitting, men, this is, I don't know if women do this. Our wallets are ridiculously big. I don't know why women have big ass wallets, but I'm guilty. But if you are sitting with a wallet in your back pocket, you are surely activating both glute minimus and piriformis, but we're on glute minimus. And then people who stand for long periods of time. So if you are working a job where, you know, you're, let's say you're a retail, you know, associate, or you work in fast food, like something where you're standing up all day, you can really be activating and irritating your glute minimus. So just kind of look out for these things. You can correct these actions on your own. Like you don't have to be, I don't know if people are on medication or what for sciatica, but you don't have to be, like there's a different option. So just consider that. Then there's a lot of pseudo syndromes that are associated with sciatica, or pain that mimics sciatica, and when it comes down to it, it could simply just be that your glute minimus is really tight and it needs to be stretched out and released. So if you've been told maybe you have L5 or S1 radiculopathy, this mimics glute minimus pain, or if you've been told that you have like pain coming from your lumbar facets, this can be also confused with glute minimus pain, or of course pseudo sciatica. You know, oh, I have sciatica. What does that mean? Probably that your glute minimus is tight. So it could be myofascial. It's not always neurological. And then we're going to talk about piriformis, because piriformis is one of the main muscles. I mean, there's glute minimus too, but piriformis actually is the muscle that will entrap the sciatic nerve. So piriformis is a tiny but mighty muscle. Like I've touched it in cadaver labs, and you know, in dead bodies. I love playing in dead bodies. I'm a creep. But it's a really small muscle. But again, the smallest muscles are the ones that cause the most hell. So your piriformis is a lateral hip rotator. So it basically pulls your hip outward. And then it abducts and extends the thigh. And the function of your piriformis is the same way we can't rotate our arm all the way in. Our piriformis is the muscle that's pulling at the hip to stop our leg, or at the hip, you know, from rotating all the way in, because it pulls out, and then when it's tight, it really pulls you out. So a clear indicator that you have issues or a tight piriformis, if you lie down on your back and just relax your body and look down at your feet. Now, if your feet are both straight, then piriformis is not your issue, likely. If you look down at your feet and maybe one of them is like this, or both of them are like this, like your piriformis is likely tight, because that's what piriformis does. It pulls you outward. So I am also have been subjugated to this pain. So for me, it's kind of natural. Unfortunately, my right leg is always kind of out like this. Even if I'm standing straight, my left leg is always straight and my right leg is always pushed outward a little bit. So you know, that's a clear indicator that you have an issue with piriformis. So piriformis pain will refer pain or send pain to like the low back, kind of on the middle part of the glutes, you know, where your sacroiliac, your SI joint is, and then on the outside of the glute. It can also kind of trickle down the back of the thigh, and it will kind of stem from the perineal region, which is like, the perineal region is basically women between your holes and men between your male parts and your hole. So it may trickle down from that region. Like if you're having pain in that region, could be piriformis, because piriformis is a pelvic floor muscle, so it helps hold everything together. And like I said, it's a tiny little joker, you know. So the pain from piriformis, ladies, if you are feeling pain during intercourse, think about, again, what I just said piriformis does. It is something that opens the thighs up. So think about, you know, what your body's doing. So if you're feeling pain during intercourse in like the perineal region and kind of going into your glute and down your leg, it could be piriformis. And you know, this muscle is just heavily involved in entrapment. Think about this muscle as the trap house. So men, this can also affect you guys, again, with entrapment. Just this muscle squeezes the nerves, so this can squeeze on your guys' pudendal nerve, and you can experience impotence. So if you are experiencing impotence, could be piriformis. So some signs and symptoms of piriformis: people who sit for long periods of time, people who are truck drivers, people who sit at desks and are typing all day and don't get up and take breaks, or people who have to drive long distances and don't get up and take breaks, or people who are Uber drivers or your delivery drivers, or anything where you're just sitting for a prolonged period of time and not taking a break. You are probably giving your piriformis hell. So after sitting for long periods of time, you just got to get up, you got to move around, you know, or you're just going to have these issues. Some other signs and symptoms are you may not be able to lay down on the side where you have piriformis, you know, issues. Piriformis is not, the pain is not as bad as it is with the glute, but I mean, they're still both hell. So what are you doing to activate and perpetuate these trigger points? So muscle overload. So let's say for glute minimus, let's say you have been squatting and like picking something up with your legs spread open. You know, this is going to activate, especially because you have, if you're carrying something heavy, like that's just overload on that little tiny muscle. So that could be it. Also, for piriformis, you don't want to let anybody inject you in this muscle either. Intramuscular injection, or even just trauma to the muscle. So like if someone has hit you there, for y'all that be hitting y'all kids, like knock it off. You can be causing all kind of, you know, long-term chronic pain. So think about that. If you have a small hemipelvis and there's like a constant tilt of the pelvis, or again, like if you're sitting on a wallet, you're going to activate your piriformis. If you have gait abnormalities, and let's say you walk a little funny, or you have, I don't want to say walk funny. Y'all know who y'all are that walk funny. Let's say you have like a lower limb length inequality. Basically, one of your legs is longer or shorter than the other, which a lot of people have that. It's actually very common. But when you do that, you can basically, most times you're like, you're rotating in and you're compressing on your natural arch, and that just sends all kind of pain, you know, up the leg, and causes some structural issues, or people who have mortise toe. There's a lot of y'all out there. So I think I have beautiful toes. My toes are like a cell phone bar, like they go perfectly down. But some of y'all have those toes where it looks like this, where the second toe is bigger than the first toe. So that's called mortise toe or mortise foot structure. And when you have this, so the big toe is a big stabilizer. It really helps in stabilization. Like there's some tiny bones in the big toe that just really help us with our stabilization. Like it's really important. So when you have that kind of discrepancy where the second toe is longer, there is a weight distribution problem, and this can also cause you to rotate in medially, and then your piriformis is going to end up compensating for the medial rotation, and bam, you got piriformis syndrome. And that's actually a thing. It's called piriformis syndrome. Also, if you have SI joint dysfunction, or if your doctor told you need to have a hip replacement, or you have hip arthritis, it could be that you just need to release the piriformis. And then don't sit on your feet. So those of you, I know we're Zen, we meditate, we do our thing, but if you're sitting on your foot, the heel could be right on your piriformis, and it could be causing you pain. So these are things that you could be doing to activate and perpetuate these trigger points, basically, in these two muscles. So if you have sciatica, consider the cause could be glute minimus or piriformis. I'm going to be giving you guys another video. Watch my video, the corrective actions for sciatica. And then, if you guys got something good from this, hit the like button for me. Go ahead and subscribe. You guys know I'm trying to reach a goal. I'm trying to reach 1K. I think we can do it super easily. So go ahead and subscribe. And then if you know somebody who work, in these type of jobs, or are complaining about the type of pain that I described, share this video with them. Send this to them. Send this to your granny. Help granny out. Granny don't have to, be in pain. So you can help people understand what's going on. Military people, y'all need to understand the wear and tear, on your body. So thank you guys for watching. Make sure you like this video, subscribe to this channel, and go ahead and hit that little notification bell so that you get the alert when I drop new videos. I appreciate my audience and your viewership, and until next time, keep healing.